Hey, Zern listeners. In this episode, I'm going to interview my friend and colleague Anthony Pennant about autism. I had a problem with my audio recording equipment, which resulted in a slight echo on my audio occasionally. So if that bothers you, you might not want to watch this episode. It bothers me, but I'm too uptight about being a perfectionist when it comes to audio things. Just be aware of that. Hey, Deserving listeners, I have a special guest with me today, Anthony Pennant, Dr. Anthony Pennant, a friend and colleague of mine, to answer your questions about autism.
Thank you for having me, Dr. Honda. My name is Anthony Pennant, Dr. Anthony Pennant, and I am teaching faculty at Antioch University, Seattle, in their Couple and Family Therapy Department. I have an interest in working with individuals on the spectrum, specifically children on the spectrum and their families, and I just recently have completed a study around using family-based treatments to support families who have children on the spectrum.
Okay, so there are a lot of questions about how do you get assessed?
That varies state by state, but I think the overall arching pathway to diagnosis is that you are with a qualified provider, which is usually a psychologist or a neuropsychiatrist or a medical doctor. If it's a child, it's usually a developmental pediatrician, right? Which they are specialized in younger children and how they develop, right? Milestone wise.
So it'd be a specialist
correct.
of some sort. You can't just go to any old therapist or any old physician.
No.
You have to find. And I'm guessing it might be hard to find those folks.
It is usually very hard to find those folks. It's not really advertised, but I think that a good starting point is that if you are an adult, right, you are starting with perhaps a therapist or your own medical doctor, right, and you can get a referral that way. If you're working with a psychologist, that might be a good way to find some testing or someone who is testing for ASD, autism spectrum disorder. But usually the gateway is you go through a medical doctor, right, or a therapist, and then you're linked into some official testing with the qualified provider.
And how long does that testing take?
It depends. So for children, there are a couple batteries of tests that you usually use. In order to do the test and then to score them can be anywhere from, I'm going to say, about a good 5 to 15 hours of time that you do. And then there's also interviews that you have to have with the family, perhaps with caregivers, with teachers, any other individuals that might interact with the child if it's a child. And if it's an adult, right, you would want to get some interviews with perhaps family members or partners or whoever they're connected to, just to kind of compile a good understanding as to like emotionally, behaviorally, relationally, what's happening for them and how they're showing up developmentally.
Sounds expensive.
It can be. It can be.
It sounds like some people wouldn't be able to afford that.
Yes, that's very true.
Because if we're talking about a psychologist, for example, or a neuropsych person, this could be $300 an hour-ish.
Upwards.
And if we're talking about 15 hours... What about people that can't afford that?
People that cannot afford that. The good thing is that most of the time if you can go through a medical doctor or get a referral from your PCP, your primary, that can be usually covered through insurance for the testing.
There's usually a waiting list, you were saying.
Correct. There usually is a waiting list. And unfortunately in Washington State, the waiting list, like for example at Seattle Children's, right, it's about a year and a half.
Yeah. But when you're an adult, I find that a fair amount of people, they're self-aware enough to be able to diagnose themselves, so to speak.
That is something I hear a lot from people, and I think that's a useful experience, right, to pull forth when adult individuals are navigating to see if they do fit, right, having that diagnosis of ASD.
So, Anthony.
Yes.
Dr. Anthony.
Yes.
Lots of questions about ABA, Applied Behavioral Analysis.
I'm of two minds. I think that historically, the way that ABA was used was more about compliance and very behavior based. So let's say like for addressing stimming with anyone that is on the spectrum, right? And we, to be honest, we all stim in some particular way. Let's just be real about that. But when it comes to stimming, it might be head banging or shaking of the leg or echolalia. It's a form of regulation, right? I just want to say that first and foremost. ABA had been used. I'm not sure if there are many providers that continue to do this because there's been understanding about that, but ABA had been used to address the stimming as like as a behavior that needs to be what's called to be distinguished. Like it needs to be gone, like extinguish it, don't do anything with it. It's a bad thing to do. And so there would be a lot of like consequences and punitive ways in which if a person on the spectrum was stimming, right, it meant like a timeout or some kind of particular action or labor neighbor, right, that didn't really get to the whole point that perhaps the person might have been anxious, perhaps the person needed to be soothed. It was a way of them being able to figure out what was happening with themselves or calming themselves down, right? And so that's an example of how the use of ABA traditionally has been
so basically
punitive.
The model might be okay, but the way it was directed, it was targeting things that just annoyed people. Like, I don't like it when he does that, so I don't care why he's doing it, is I guess what they're coming from, and they're just going to use this tool of punishing a behavior because it just annoys them, instead of thinking, well, let's look deeper as to why they're doing this.
Correct.
Help them to soothe themselves in a variety of ways.
Correct.
For example.
Correct.
Or what's aggravating them to begin with. So getting rid of that thing that's aggravating them.
Correct. And the application of ABA also, this is a critique, I think rightfully so, is that it is not about the emotions of the individual. It doesn't really tie the parent with the child, right? Or the individual with other people relationally, so that there's a preferred or reward of the relationship and understanding versus like compliance of making sure you're never behaving this particular way.
Is there a good depiction in the media regarding autism?
Whenever you talk about a good description or a good understanding, right, illustration of what it's like to be on the spectrum, there will always be this divergent amount of like if it's good or bad, or what it does do or what it doesn't do, or what it covers or what it doesn't cover. And to me, I've stepped back and go, you know what? That's kind of like it is for describing a person on the spectrum. No two people on the spectrum are the same, right? And how they show up is not the same. I think it's because we're human, right? And no two humans necessarily are the same either, right? Like, however, I think there are a couple of cool things that I like in video and film that like really talk about what it's like to be a person on the spectrum. Love on the Spectrum on Netflix. It shows, I think, some of the ways in which individuals have grown over time, right? Since they've gotten their diagnosis, going through ABA, maybe doing some relational work, doing therapy, coming into their own, finding, accepting themselves and having people accept them. One thing that I really like a lot, this kind of like goes to like some of the family work that I've done, is that you see the parents really give a lot of like love and affection and belief, right? And like confidence that they know that their kids can do these things. It's unfortunate, but you see, this is a side note, but you see a lot of individuals who are on the spectrum be talked to and talked about like they don't know how to do things. To me, I think it's so interesting, right? One of the things that we talk about, one of the things that are in the DSM that talks about people on the spectrum are that they're fixated, if you will, on one topic, right? And they will consume all knowledge about one topic. Okay, I just went to grad school and a doctorate degree, and I had to do that same thing too, right? So how are we distinguishing that as a pathological thing versus what I just did, right? What many other people do, right?
Yeah.
What medical doctors do, right? That they consume all this information. It's the one thing they do and breathe, but one thing is great, and another way it's not. So
some people were saying that they would get yelled at for using a term like mild autism or high functioning autism.
I think that at the base of it, it's how we talk about what we call disability, right? Which is about what people can't do. Right. And that when you use adjectives or any kind of descriptive words to talk about a person, it handicaps them, quote, right, around what they can't do. Right. And so when we hear about high functioning or severe or mild or any of the other ways in which people talk about an individual on a spectrum, it is always that dialogue around what they can't do. Right. It's an impairment of some particular kind. I agree to a point, but I think also like, we have to have some way to categorize this. We maybe need to do better about what words we choose.
I've
Right?
heard people using different levels, like level 2, level 4.
There's like, level 1, 2, 3, and 4 depends on how impaired a person is. But like part of this is until we stop talking about the diversity of ourselves, how we emotionally or neurologically are made up, until we stop talking about it in a way that's pathology based, this will always be a conversation that we're having.
So if there was no stigma, then the gradations, labels would be less hurtful and less problematic.
Absolutely.
So Anthony and I recorded for a while, and then I was paranoid that something was going wrong with the recording, and so I listened back and there was something wrong with the recording. So I don't remember what we've talked about in the first recording or not. So When it comes to ABA, would you recommend it, I guess, knowing what you know?
That's a loaded question, Kirk. And I think that part of it is that my view, I'll start here first. My view of treating an individual who is on the spectrum needs to be family-based first. And I think that even that's for an adult, right? There should be some kind of relational aspect as to what's happening where the person is in, like the community that they're in, right? Their family members or loved ones, right? Because that source of support is going to be able to support the individual, and that there's impact, right? And
well, as family therapists, we're probably
Yes.
oriented this way.
Yes.
In general, it's not just for autism; it's for ADHD,
Absolutely.
depression, personality issue. Yeah, because all these things impact one's relationships, which in turn affect the condition.
That's true.
If you have autism and you are in a loving family that understands the situation, then it's just a difference, just a learning difference or a different way of approaching the world that isn't pathological. It's not a problem. It's understood. People know how to communicate about it. Whereas if you have an individual that is in individual treatment, but everyone around them is in the dark and has all the myths and misunderstandings, then that individual with autism spectrum will suffer greatly.
Absolutely.
So that's what your dissertation was on.
Yes.
And what exactly was the method?
I used structural family therapy for those families, and they got treatment for 10 sessions. It was an abbreviated intensive, if you will.
By you or someone you trained?
I got 2 interns. Shout out to Madison Park and Zachary Lopez. They're still working on the project, my research assistants.
Exactly.
But they're the ones, the therapists that were trained in structural family therapy and how to use that model. It was modified to incorporate the needs of an individual on the spectrum along with their families in that dynamic and environment. And it was, like I said, 10 weeks. We got some measures, and what we found was that families appreciated being in therapy together, number one, right? That was a really fun thing for me to see, and I think that they experienced. They got to know each other in a different way. They got to understand that, like, the treatment was more about bringing them together and it not being about managing, if you will, ASD symptoms.
What would be a typical session? How would that look?
That's a good question. So maybe one of the presenting problems would be that the child didn't do their homework, right? And became rigid around, like, the sameness that, like, I don't want to do my homework because there's something on TV or a preferred activity, if you will, which, mind you, is like a normal thing that kids deal with.
It's a very normal family session.
But sometimes they get a little more intense, right? Based on, it is true that, like,
so
there's
just to pause you on that idea, how does being on the spectrum affect that very normal thing for all kids? I don't want to do my homework. I'd rather watch TV.
I think sometimes what I've seen, right, is it's been a really double down on things, right? Like there becomes the no is a lot more intense, right? And it is like it's bigger. It's maybe more rejecting, right? Maybe it's not.
Why is that?
In general, school can be very stressful, and I think if you're on the spectrum, dealing that may have some social issues, right? Or like connecting socially with people, or feeling overwhelmed, sensory issues. Again, how verbal things school might be. It's taxing, right? And so they keep it all together throughout the whole time in school, and then it's like, well, you got to do your homework now. No. And it's not about refusing to do the homework. It's about how heightened they might be. It's unfortunate. And just a side note, I know that schools do try their best. I think that they can be more willing to working with mental health therapists, right, around that. But they also balance the needs of all the kids in the school.
What are they doing, or what could they
I think
do?
like inviting them to IEP meetings, so individualized education plans, right? And listening from those who are treating and seeking out, school systems seeking out that, like, hey, we need more training in ADHD. We need more training with those who are on the spectrum, like ways in which that they can not intervene, because it's not necessarily treatment, but to be with them, be different with them. So
it's just the teachers knowing approaches.
Correct.
And they don't have to have the kids in another classroom. It's just
Correct.
a different accommodation or something like what could a teacher do typically?
So for example, perhaps someone needs like some sensory time, right? That it might be too overwhelming come second period for the individual, and knowing what signs to look for or how to ask and talk to the person, like, hey, I noticed you get a little squirrely around like third or fourth period. What's happening for you? And they might go, it's too much. It's too loud.
Because as with ADHD, for example, it's not the difference, the neurodivergent difference. It is the way in which they're a round peg being shoved into a square hole.
Absolutely.
And then they feel like there's something deeply wrong with them, and everyone else thinks there's something deeply wrong with them, which leads to defiant behavior.
Correct.
And anger and shutting down, and then that creates actual issues that the system starts to react, punish and discipline.
Because it becomes a power struggle at that point.
And reject, emotionally, label as a bad kid, that kind of thing. And then they're 45 years old and they go on the internet and find out that, wait, so it was just ADHD the whole time?
Exactly.
It was just autism spectrum the whole time? And if I would have been diagnosed at the age of 5 or 7 and had a supportive system around me, I wouldn't feel
different.
like there's something deeply wrong with me. My parents wouldn't have locked me in the bedroom for 5 hours at a time and made me feel like crap, and I wouldn't have now a traumatic disorder. Right, so getting back to the family therapy session, what it would typically look like. So your family therapist is there, you have the parents or the siblings there as well?
Correct, everyone in the family.
Everyone's there, and the therapist intern at Antioch is working with the family, and the issue of homework comes up where the parents are like, he refused to do his homework. She refused to do her homework yesterday. What might it look like? What's a typical way that might look like to help the family?
So some of that is examining where the parents are in that request, right? And examining where the kid is, perhaps in that situation, and where the siblings, if there are any, might be, right? Because the parents are having an experience of a kid perhaps not being flexible enough in the particular moment, or just not being compliant, if you will, right? And then it gets transposed onto like, this is just why you're so rigid, and it's partially because you're on the spectrum, and I'm having a hard time doing this, and it may not be. So getting them to slow down, right? And sometimes speak the same way, because with parents, sometimes one person is the disciplinarian and one person might be the more the nurturer, right? But getting them to be on the same page to kind of go, okay, what's happening for you, child? What can I help you with, right?
Which is good parenting for any kid.
Exactly.
Is it just that if there are cracks in the system parenting-wise, it'll become more evident if a kid has a neurodivergent issue?
I think yes, overall, and structural would say absolutely.
Yeah. Having options and being attuned, and not just automatically assuming that because little Jane is refusing to do something, it's because she just wants to be a pill,
Exactly.
if you will.
Exactly.
But maybe there's something else going on. And so just taking a time to ask, or how do you feel today? And in the families that I would work with, I would say, this is where we want to be, where you can actually have, say 50% of the time, your kid will open up to you under those circumstances where they give you some attitude. You're just like, something going on? And 50% of the time, the kid says, well, yeah, I don't want to talk about it though.
Yeah.
Or whatever. And so you just have some acknowledgement.
Exactly.
But that's where we want to be. And you've never done that yet. That's never happened. So we're not going to get there overnight. And you could ask that question 100 times.
Exactly.
And the kid will be like, why are they asking that question? This doesn't feel safe. I don't even know how to answer that question because I've never grown that muscle of how to talk about or even know what's happening with me. So whatever age the kid is, we have to start there. And I tell the parents, this is a question you're going to ask a lot of yourself. Like, I wonder what's going on. And then there's a way of asking the question, and don't expect the kid to respond.
Exactly.
Like they're going to, in all likelihood, initially say like, screw off or nothing, I'm fine, because it's terrifying.
Yeah, it absolutely is.
So it sounds like just regular family therapy. Also, I guess with the added layer of helping the parents to take a little bit more time, have a little bit more patience, understanding what the kid might be going through internally, emotionally.
Yes, and I want to go back to what you were saying about like, how does this look specifically for the kid? I think the therapists were like advocates, right, for the children to be able to do that work, right? Part of what made it intense is that there was a lot of action, right, and pressure that was put on the system, if you will, if we're just talking systemic ways, right, to make and do changes. And so while you got the parents to kind of slow down, right, and to be in a place to hear from the kid, the therapist worked with the kid to be able to share with their parents about what was going on, and some of that can be difficult for those who are on the spectrum, because again, it's change, but it's a little more heightened, right, around like, how do I do this, why do this, it's unpleasant, I don't like that, right, like, or it's touching on different parts of my emotions that like ABA never got to, right, but I know that are there and we don't talk about it, kind of like you were saying. And so pushing them to be able to talk through that discomfort and be able to share their real emotions, right, shows them that this change is a good change, right? And there's a lot of ways to kind of slow down their own internal like anxieties and overwhelmed like states to make it rewarding to be connected to their parents, right? And then likewise, if there are siblings that are there, some of the siblings are brought into therapy to talk a little bit and witness that like their sibling on the spectrum, right, isn't one dimension, right? That's part of the thing that that happens all the time. That family therapy, it's basic family therapy to a point, but some of the conversations that are infused in some of the interventions and what have you are talking about how the person is a person. You're on the spectrum, yes. You understand some of their needs, and some of the needs they will tell you about, yes. And they're still a person. They are able to change. They're able to be seen in different ways.
Right, because often there's this myth that people with autism lack empathy.
Correct.
Or they don't care about other human beings. They don't want relationships. Where does that myth come from?
Movies.
Yeah.
Right? Like this conceptualization that they're, again, those who are on the spectrum are strange, right?
Yeah.
They think of things in a very different way.
Well, true. Are there other reasons why? Because for me, the people that are higher on the spectrum that I've worked with, there's one kid I worked with for a while. He didn't have eye contact much, not verbal until he was maybe 14 or something. And then when he did talk, it would be pretty limited. And also sometimes perseverating on certain things. He would perseverate on someone at school. There was this kid that he would compulsively talk about and obsess about, this one boy at school. He would have outbursts sometimes. I think if you understand autism, you understand that he wants relationships just like everyone else. He has empathy like everyone else. But from the surface, as a family member, you don't know what's going on. You're trying to connect with him, and he doesn't respond in a way that
You think
indicates that he cares that you're even there, right?
Yep.
What's your understanding of what's going on there for the individual that's creating that look as if they don't actually care or they're not interested in you?
To me, I think the bigger part of that is just being overwhelmed. I think it's a sensory response, right? That, there could be 101 reasons, 1,000,001 reasons, really, if you're right, around why an individual might talk about one person at school and perseverate like that, right? But part of it could be that they enjoy school. That person is getting in the way of them enjoying school, right? Or that, like, this is a person they want to be friends with, but don't know how to talk about things in common, or like have the ability or want to like go up and talk to them, right? Like there could be 1,000,001 things. And so it's, to me, a state of being overwhelmed, and how to collect ourselves, how to process through what's happening for them in the particular moment. But it's a lot. It's a lot.
Right. That's my understanding of at least one of the theories, is to sensory input is turned up, or the brain isn't able to distinguish between things that are
Correct.
Ignorable versus things that one should pay attention to.
Correct.
Like right now, you and I are processing a lot of sensory inputs. There's the lights and an airplane going off over it, and a fan going off over there, and there's a lot of lights and things around. And of course, I can feel the chair, and I can feel my shirt, and I can feel my socks on the ground, and there's a temperature. And if I think about it, I can even feel my hair on my head. There's a lot of things that are happening. But for people on the spectrum, they might be paying attention to all those things
At the same time.
Including noises are louder,
Correct.
lights are brighter. As a parent, you come up to the 3-year-old child and attempt to have a little eye contact and a bonding moment. The child looks as though they don't care, but
They're
might be
preoccupied.
Preoccupied.
Yes, and processing. The thing that was, I think, is really interesting to say is that during that time when all that intake is happening, right? There's still like, how do I process through this? Oh my gosh, it's too much. What am I going to do? Can it just stop? Oh my gosh, why am I in this position? And boop, 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 and just goes up, and then a glass that's really full of water, right? And then someone wants to come pull it, like pour more. It's going to spill over, right? Because it's like a shutdown. Like, I can't take anymore. Don't want anymore.
A lot of our understanding of social situations is developed when we're very young.
Yes.
And throughout our life, but also when we're very young. And when we're literally 9 months old and we're having eye contact with our parents, and their facial expression is saying something and then ours says something, and we use a rattle and our mom says, "Oh, rattle," and you're like, "Oh, is this?" So we're both concentrating on the rattle now. It bakes it into the neurological pathways about how that all works and how other people work and how you work and how your facial expressions work and how eye contact works and how understanding, mentalizing, and do they understand what's going on with me? It's very complicated, and it's developed over time. And we know, for example, if you have a kid that's neglected, they don't develop normally along these lines, and there's a window of time.
First 3 months
is hard to make up for if you don't capitalize on that plasticity that's present in that formation developmentally of those kinds of pathways. And you could imagine that if the individual, even if the parents were suspecting that a child was on the spectrum, but given all the stimuli that could be overwhelming or eclipsing the interaction with them and their parents or family, it could, just by that alone, would essentially make it difficult to develop those pathways and that understanding, and thus when you're older you have more difficult time reading social cues, as they say. Not because it's something inherent to autism, but something that the oversensitivity to all stimuli would have made it more difficult to develop those skills early in life. Does that make sense?
That does make sense.
Yeah.
That does make sense.
Anyway, let's look at some of the questions here. There's a movement to combine ADHD and autism spectrum. What do you think of that?
I disagree with that.
Yeah, me too.
I don't know that. No.
I understand why people would think that from afar, but when you really understand ADHD and autism spectrum, you're just like, no,
exactly.
They're very distinct things. You can have both.
Exactly,
You can be
comorbid.
confused between the two. But, so just getting back to ABA, because there are a lot of questions about it. So do you know anyone in Seattle, for example, or do you know anyone who uses ABA that you would say, well, they're using it responsibly?
I do, and it's not because she's a family member of mine, but my cousin, Naya McAuliffe, she's out in Kitsap County, although she'll be moving soon. Very sad to hear that. She does ABA, but it's not about compliance and breaking a behavior, right? There's a little more emotion and relational things that are put there, and that if a kid says no, or I'm not going to do that, there's like a curiosity as to like, okay, well, what's happening? Right? Not a you're not complying kind of a line of credit, and trying to bring the parents in and be a partner, right, around the mastering of some of these skills has been really important. I would even say that the way that she sets what skills need to be done is collaborative in approach, right? It's like, okay, family, what skills do you want to be done? I know this is what comes over, but what skills do you all see that are really needed in order to feel successful, right? And so I would say that is one a provider, and I know some other providers that do this, but try to set the goals that are based on collaboration as opposed to like compliance.
Would some ABA practitioners or experts look at her work and think that it is enabling bad behavior in the kid?
Probably.
Someone asked, how do you think autism screening can be improved to serve minorities? The process is discriminatory and fails to diagnose children of color, instead labeling them with a behavioral issue and often sending them away to different classrooms or schools, punishing them for being autistic, essentially. What do you think about that?
It's true. Very true. This is from some of my personal experiences as a clinician working with some families who have a kid on the spectrum. Some of the behaviors that I've seen about that are displayed, some of it is displayed according to the culture of the family, right? And so the culture of the family has to do with maybe racial, ethnic makeup, gender roles, ethnicity, customs, and things like that. Maybe even style of talk, right? Or how people talk and when they talk. And so understanding the culture of the family has to happen while you are assessing the family. You got to this is why it's important to like talk to the parents. Right? It isn't about just interviewing the kid and talking to their community to figure out and asking questions, all right? Or you are from Ethiopia, okay? Are you from here? And what tribe do you belong for this? And what language do you speak? What custom is important for you? How do you celebrate? How do you grieve? All these particular things. It's important. It's important to know there isn't a difference there's a difference, and it's not just what appears on the paper in the DSM, right? Which is unfortunately, but it is a very white centric way of looking at like
How so?
this particular. Well, perhaps like the way that we're talking about like rigidity, right? Rigidity or even closeness of relationships, right? Like differ for a lot of people. Some of the rigidity that families have or individuals may have may be around keeping of customs, right? And how they show up in the home, but it doesn't mean they're rigid. It's more of a cultural expression, right? And the norm of the family. So, and I've seen that kind of like sometimes be pathologized, and I've seen that kind of be missed, right? When they're assessing, when they go, well, this person's very rigid. Well, how? And then they give that example, and it's like, that's not rigidity. That's maybe
Like what's an
adherence.
example?
For like an example of like adhering to particular, like let's say a custom of the family, right?
what
Or like
kind of a
celebrating,
custom? Like, is there a
celebrating something, praying at a specific times a day, wearing certain things, right? Having discussions in specific ways. So, for example, when we hear Black families, this is very, I do this myself, but the word disrespect. I mean, it happens across a lot of cultures, but Black families in general will talk to their kids about disrespect, right? And so if you're seeing that the kid is quote unquote disrespectful, right? And then they're using the words, like the kid are using the word disrespect, their parents are using the word disrespect, the siblings are using that word, and it feels like there's just such rigidity around where they are and what's kind of going on. You might say that, oh, there's a compliance issue, right? They're not really on the spectrum. They're not really having difficulty adhering or understanding what their parents might need, right? They're just disrespectful and they're this conduct disorder, right? Or explosive intermittent explosive disorder, right? Or, ADHD with aggressive type or whatever, things like that. It's always
because the way the family is labeling the kid.
Correct.
So Kenny asked, how does the law of consent work for autistic people, depending on the type of autism, they say?
The first part, I'm like, it's a strange question to ask because consent is consent for everyone. But I would love more information as to what that means.
I don't know.
There's so many things.
If, for example, if you're a parent, I'm guessing, and your child is autistic and say they're 25, but they are in a situation such that they can't pay their bills or have a job or function independently, as they say, what's the thought around them providing consent to have sex with someone? They start to date, and as a parent, you're watching your 25-year-old dating, and the other person seems to have more wherewithal or something, more power.
Fair.
And you think,
Is
what
this a
if
good thing?
they...
Yeah.
They're in the backseat of the car. I don't know how I feel about this. Should I think of it, well, he's 25, or should I think, but he kind of is like he's 12 in a sense, so is it okay to just say, well, you have autonomy?
I would say the biggest thing is when you think about like as a parent figuring this out for their adult child who is on the spectrum but struggles with independent living, right? My thought is that, number one, guardianship would be in place. Guardianship is a process in which parents can still retain their parental rights over their child to a point, depending on where the person is, I would say, in adulthood. So that allows them some rights to be able to do that. As far as having that conversation, that's a really good question, right? I think that the first thing that comes to mind is like, what's the emotional age, developmental age of the person? Right. And like you were saying, if it was more like a 12, like how are we understanding what sex or sexual or touching, right? Because that's the part. It doesn't have to be about sex, but just like your own body, right? And your like consent to things, right? Your autonomy. How are we thinking about that? How are we talking about that? I think just have the conversation with individuals, right? See where they're at. Right? Because maybe they might be emotionally around 12 or 13, but they understand what sex is and why they want that and why they want to be touched. Right? And so have the conversation.
Okay. Yeah. Yeah. The autistic kid that I worked with, he was a teenager. Like I was saying earlier, he barely spoke, and I think he started to speak later in life, like 10 or 12 or something. But he went through puberty and was now interested in touching himself and would just do it anywhere. And it was, at first people were shocked, and then eventually people were like, well, what are we going to do? And then we went on a program to help him with it, and so we explained in a way that that he eventually understood, and we said, here's the procedure.
Yeah.
You go into the bathroom, you close the door, this is what you do, and then you wash your hands, and you pull your pants up, and you come outside, and we're good. And so every once in a while, he would just be like, and he'd go into the bathroom, and he'd come back, and it was fine. You give them a way,
Yes.
and they do it.
Yes.
And he was really good about that. Whereas if you punish, for example, and shame or turn away, then you're going to create a complex there.
Yes, you will.
So with consent, as you're saying, it's like, well, have a conversation with them.
Yeah.
Do they know what's going on? And if they don't seem to have any awareness of what's going on, then I would intervene. But if they can develop the understanding of their bodies and their rights and what they want, then they can begin to figure that out on their own.
Exactly.
The way everyone does.
Exactly.
Yeah. Interesting. Okay. Deserving listener Josephine from Sweden says, my brother has Fragile X syndrome, which makes him severely autistic. He has the mental capacities of a child and has always had a small vocabulary. He hasn't known how to express his feelings with words his entire life. He's 34 now. A few years ago, up until today, he got to ride horses at riding school weekly. Since then, his vocabulary has expanded and he can express his feelings with words. Like when he talks about our deceased brother, he will say, I miss my brother. He will always be in my heart. So my question is, how can horseback riding make such a difference with someone with autism?
Okay, cool. You got a listener from Sweden? I didn't know you had pulled like that, Kirk. So I would say that there's a distinguishing thing. Fragile X and autism are two different things. Fragile X is what's called Down syndrome, right? And so it's got its own presentation and its own like particular issues. That doesn't mean that, again, you can't have things that are comorbid, right? I was very clear about that. But there are two separate things. With regard to why equine therapy, like using horses, could help could be of use for individuals. Again, this goes back to the thing about how we all learn. Right, and how I've ridden a horse before, and it was the most regulating thing in the world. I was scared; it was huge. Yeah. It had it right on its own.
I just started giggling. I couldn't stop giggling. It was so exhilarating, and it was moving on its own.
Exactly.
And I got the fast one, and it just started running, and I just couldn't stop laughing. I'm like,
I mean, it's true. I vibe with that, but there's something regulating about knowing that you're that high up, or that this thing is moving and you can control it, and it's regulating and it's great. And I think that perhaps is why equine therapy might work for this individual, because it regulates them and grounds them in a way where that overwhelmed internal sense perhaps is turned down, maybe a lot, maybe slightly, and just enough so they can make better decisions and talk about things and just to kind of grow. And part of it is also, I think, probably maturity when I think about that. 34 years old, so we all mature, we all develop, and perhaps that's just the milestone that he's hitting at this particular time too.
What are the common myths that you still run into?
Common myths are, if a person's on the spectrum, they will always be that same person. They can't really like branch out and do different things.
What do you mean? Like they're limited to
maybe always wanting to know about guitars, or they'll always play this particular video game, or they'll always greet you in the same particular way, or have these rituals about things, and they'll never be able to change about it.
So people will kind of give up trying to help them spread their wings.
Yeah.
I see. What other myths? I mean, there's the common ones, like they all have a savant aspect, like Rain Man being able to count things, and there's that myth. There's only a small percentage of people with autism spectrum that have.
I would say humans. I would say humans. that IQ.
Yeah, right. But a higher percentage, though, right, of people with autism.
That is true. Have higher IQs.
My understanding is that, or maybe everyone has the capacity, but if you have that overwhelming aspect to data coming in, you might find it comforting to kind of go toward your strength and say, well, I feel like I'm pretty good at being able to identify the day of the week, regardless of what year, or, you just say January 2nd, 2055, I'm very good at that. And so I'll hone that skill because it's kind of regulating for me to do something that I can concentrate on. And so maybe everyone has that ability, but they just never realize it or develop it further because it's not important. That, like I have a cousin who can multiply any numbers.
Really?
You just give him any two numbers and he can within 2 seconds give you the
What?
Yeah. And I don't think he's particularly good at math, like he's not good at calculus, or he just has that one skill, and he's not on the autism spectrum. And so maybe all of us have that capacity, but for people on the spectrum, they just develop it further.
Yes, I think that's a possibility. There's another method as you were talking that came to mind a little bit, is that this is usually in the presentation for those who may have severe autism, right, and might be comorbid with some other things, but that they're unpredictable and dangerous and violent, right, and you see a lot of that within school.
Like Sandy Hook.
Yeah, you're gonna hurt me and you're gonna do all these things, or if I ask you to do something, you're not gonna understand, and that's the way you're gonna be able to talk to me, is through violence, right? And that's so not true.
Right.
So not true.
Yeah. Well, there are a number of questions about girls and women on the spectrum and how they're often ignored and misunderstood and how it might present differently.
It's absolutely true. Based on, the DSM, how they got to understand, through the research studies, right, around the APA, if you will, around how do we solidify this diagnosis, or what are we seeing in this diagnosis of autism, was mostly males, right? And it was not about anyone that was woman at all. So I think that socialization plays a role into that, right? Definitely around how agreeable perhaps a person can be based on their gender or perceived gender, right? Some of the things that they decide to do around the house, right? Perhaps, right? Or how they move about in their lives, or even in school, how they show up, right? Like, again, how agreeable or compliant they might be.
If someone came to you and said, I think I might be autistic, and they're, say, 40 years old, what would be a few questions that you would ask as an initial screen that if you got certain answers, you'd say, well, I can't obviously diagnose you, but you do have some of the indications, so I would get an assessment? Because some people are asking questions like, what are the simple ways of differentiating between someone? Because there's a fair amount of people that will say, I have autism, and then when you actually ask them a few questions, you're like, no, you don't. It's sort of like with ADHD. So there are questions that I ask that will be like, well, tell me about your distractibility in various different environments. So if it's difficult to focus at school, but at home you find it very easy to direct your focus,
Exactly.
then we're probably just thinking about some other issue. Because if you have ADHD, then generally speaking,
it's going to be everywhere.
You have trouble focusing your attention in every environment. And there are other kind of quick screening questions I wouldn't diagnose from, but it would be a quick way of getting a sense of what's going on. What kinds of questions would you ask to assess that with autism?
As an adult, I might ask questions like, tell me about how you connect to other people. What are the things that you might do for fun, and who do you do it with?
Okay.
Right?
So what would you hear from someone that had undiagnosed autism?
Perhaps they might say is one person in particular that they do things with all the time, right? And maybe that one thing that they do is along the same lines of things, might it be, or that same thing, right? Or it might be something like, I have a difficult time being able to talk to people. I don't have many friends. Right, and I might dig in a little more, like, well, what do you mean, Liz? Are you more of a, like, everyone that is kind of like an introvert in Seattle, like, you know what I mean, or is it something a little difficult, right? Like, and so I would look for in some of the lines of questioning that I would have, or is this person really have difficulty being able to connect socially with people because it's an internal thing around anxiety, pressure, being able to communicate how they feel, or an interest perhaps, right, around things, or the lack of interest in what other people might share with them, right?
Okay.
So that might be something that I do. I also would look and see, like, with regard to how do they feel about intimate or close relationships, right, and who these people are, and how they describe it, right? If it's really like elementary, not even elementary, if their answer is more of an avoidance around having intimate relationships, and it's not better explained by like trauma or abuse or things like that.
They might say, well, I'll tolerate going to a party, or if I have to, or I'll tolerate hanging out with those people if I have to. That meaning that's what you mean by avoidant.
Exactly.
Like they're on their heels instead of enjoying themselves or something.
Or making a choice to want to really do that activity.
Okay, interesting. Some people asked about couple therapy with people, one or more people.
Yeah.
How does that work?
It's a newer thing right now, right? Neurodivergent couple therapy, if you will, right? And so what a lot of that is like slowing down one partner to get them to a place to understand who their partner is on the spectrum, right? And accepting that that plays a role in how they show up in the relationship and loving them for that. Not that they don't, but really making it like known that like this is what that is. But also, and vice versa, because, you know, this is couples work, so there's reciprocity there. Working with the person that's on the spectrum to understand that they have to communicate with their partner, right? And the best of their abilities and try new things, right? And that they might be pushed to do something different in their relationship because people change, life changes, you have to adapt in order to keep surviving and thriving. And they might need to ask their partner how to do that, or signal to the partner that they're having a hard time doing it. Some of it is very basic couples therapy stuff, right? But I think with the nuance of knowing how to talk about the issues that are very like particular to those on the spectrum are super important.
Yeah. I had a couple that I worked with once along these lines, and one example is he would at times get hostile, not super hostile, but kind of hostile. Like they would be socializing with friends, for example, or they'd be at a restaurant or a park or something. And he would just say, I'm going to go to the car. If the wife was with friends, she's like, we just got here and I'm trying to impress my friends and introduce you, and you're going to go hang out in the car. And he would get angry and just like, you know, I didn't even want to be here anyway. This restaurant's stupid, or, you know, whatever. And that's the surface level.
Yeah.
But underneath it was being overwhelmed and being worried that he might not know what to say in a larger group with people he didn't know that well, or that he would be excluded because he doesn't know these people. And so his go-to coping is to just get out.
Yep.
And so what we did was, one is to understand that and not interpret it as a hostile act, like he doesn't want to be married or doesn't care about her feelings.
Exactly.
Try to elicit him to talk about what was going on for you. And maybe it might be hard for him to know that because he hasn't a lot of experience with that, but it takes a while. And he's like, well, I was completely distressed for 3 weeks leading up to this dinner because I knew it was happening. And I thought about it all the time, and I didn't want to bother you with it because I thought I was being ridiculous for worrying about it. And I knew you wanted to have a good time, and I wanted to be a good husband. And when we got there, the restaurant is not the kind of restaurant I thought it was going to be. You told me it was going to be this kind of place, but it was way more busy than I thought it was going to be, and way more chaotic. Your friends I didn't feel good around them. I was getting really angry and I was going to the bathroom, like yelling into the, urinal as I'm like, what the fuck am I doing here? And I said, I got to get out of here. I'm going to do something bad. Meaning I'll be hostile directly in front of these people. And so I just need to go to the car. And if I go to the car, I can stare at the window and I can calm down. And that's what I did. And it's like, oh, okay. So you understand. And then it's like, well, what's another way that we could have dealt with that?
Yeah.
Like up until the moment, like, honey, it's 3 weeks out. Could we go to the restaurant beforehand and
try run?
Yeah. Tell me about these. What's your expectation about? Is it okay if I don't talk much? Like, could I just not talk, or could we limit it to 45 minutes?
Yep.
And then can we just say I had an appointment, I have to go. 45 minutes, and then, like prep. And could you hold my hand at dinner? Or whatever. Could I go to the bathroom
a couple of times throughout every 10 minutes?
Yeah.
Like,
and so having that understanding, which is of course good for anyone, regardless of what we're facing, is the treatment, So it doesn't, the model of couple therapy is the same, but it's just taking the possibilities, prompting, sort of priming the pump. If you're a couple therapist and you can detect these differences, you would be able to, even if you're thinking, well, the husband, he's got a job, he's successful, he's smart, he understands how the world works, and not assuming that translates to social abilities and lack of distress in those situations. I mean, he might even give lectures to full 300 people in a room, and it's, well, he's obviously very confident, but that's different than sitting down. To you, it might be the opposite. Sitting down with 3 people that you don't know is way more comfortable than getting up on stage. But, for him, it might be different. And so detecting that, knowing those differences, and then being able to elicit that conversation from that individual is just like, so what really was going on for you? Like, it's okay to talk what was going on. So that's what couple therapy looks like for me when I'm aware of what's happening. So Patron Joe from Chicago, this will be my final question. What do we know about the connection between oxytocin and autism?
So there's been actually some clinical trials that have demonstrated that the use of oxytocin in children who are on the spectrum, what it does is it helped regulate them to a particular point so that they can feel less overwhelmed. So touch, hugging, kissing, like demonstrating that affection seems to come more naturally with that. However, there have been some...
they'll administer oxytocin.
Yeah, they'll administer oxytocin. Usually it's through like the nose, right? I don't know if they have an oral drug of it, but I think it's like you sniff it. Yeah, like a spray. And what it does is it administers like the love drug into the body, which promotes bonding. The oxytocin is highest in individuals when... a mom will have a kid, right? That spurs the bonding, and the kid has high levels of oxytocin because it has to bond with their mom during nursing.
Interesting. Yeah. So I don't know if this is what they're thinking as to how it works, but I could imagine it priming the pump. It gives a feeling of bonding artificially, but then you feel this urge and attention to wanting to do more eye contact or more interacting with people. If I was to think about it, I would say that there's a lot of needs happening inside of them and a lot of needs that need to be met. But since there's a lot of input, one of their needs of bonding and attachment is being sacrificed for other things because they're paying attention to other kinds of things. Then you give them a little bit of oxytocin and that need gets met a little bit, and it's like, yeah, I'm here, yes, that feels nice to feel some bonding feeling. Oh, that's right, you're there. Let's focus on my need regarding bonding and attachment. And maybe I can push aside some of these other distractions and actually go for meeting my own needs. You're not priming them to make them more attachment oriented. You're just helping them to maybe focus on it more.
Yeah, and then the neural pathway starts to develop and be like concrete, and knowing that that's something you can do and you can internalize that skill. But the biggest thing I want to say is that it doesn't cure autism, right? And I think some people think that it can, and that was part of the reason why they did this clinical trial. What it does, it just makes it easier for those who are on the spectrum to feel good about like enacting this like attachment, right? This bonding, right? And feeling good about being able to do that instead of feeling overwhelmed, perhaps that it feels too much to be touched.
Right. Yeah, lots of misinformation.
Correct.
And pseudoscience around cures and causes that are obvious that we don't have to necessarily go into. Vaccines and diet and these kinds of things as identified as both cause and cure.
Correct.
Which has not been shown by the science.
Not at all.
Yeah.
Not at all.
Well, thanks for coming on the podcast, Anthony.
Thank you very much, Dr. Honda, for having me here.
Yeah. And everyone out there, please take care of yourself. Why should they take care of themselves, Dr. Anthony?
Because, well, I'm going to say RuPaul's thing, but...
Say RuPaul.
If you don't give a fuck about yourself, if you don't give a fuck about the world, oh, scratch that.
No, do it again.
If you don't give a fuck about yourself, then nobody else will, basically.